Next topic is quinolones, the most commonly used malpracticed in different countries, and the most common cl- class of the drug, antibiotics, which are malpracticedly overly prescribed in different parts of the countries. So quinolone, we have examples of respiratory quinolones and the general quinolones. So respiratory quinolones, we have the Moxi, we have the Levofloxacin, Moxifloxacin, and then we have Gemifloxacin. Then in the general, we have the Ciprofloxacin, we have the Ufloxacin, we have the Norfloxacin, and Enofloxacin. So how these antibiotics work? Their mechanism is to inhibit gyrase, which is the unwinding enzyme helping DNA replication. The main enzyme, one of the main enzyme. Gyrase is also known as topoisomerase, and particularly the prokaryotic topoisomerase. So how this little cell prokaryotic get resistant to it? Change the gyrase. Simple mutation in the gyrase encoding gene. If it's uh, not effective, then it can either use plasmid mediated resistance, plasmid encoded MDR, like it can get resistance from another type of bacteria. Then it can also use efflux pump out all the medicines. So there is a caution, there are two cautions: never use quinolones with antacids. We have known that quinolones are actually the fluoroquinolones. So my proposed mechanism of this antacid induced fluoroquinolone caution is that the antacids can form chelates or precipitates. That's why we never use antacid with quinolones, and also never use in contraindicated in pregnancy, pregnant female. And I'll tell you why. Because the side effects over here in pregnancy and the patient which are on steroids, it can cause tendinitis or tendinic rupture. It can cause damage cartilage damage. Quinolones are P450 inhibitors, and also quinolones are causing GIT upset and headache, non-specific symptoms, and then rash and dizziness. Also, less common effect is it can cause superinfection, which be a flag sign for those physicians which overly prescribe this. And less commonly, it can also lead to prolonged QT interval, so cardiac effect. So where we use quinolones? Quinolones are used specifically whenever there is a gram-negative rod infection, particularly Pseudomonas aeruginosa, and these gram-negative rods which are causing UTI and GIT problems. And also we can use in otitis externa and some gram positive. So this is the important points regarding the quinolones. The next class is metronidazole. Metronidazole is also very much used, and it is used as homeopathic doctors which use it as the below the diaphragm use, like the infection which is causing infection below the diaphragm, we use metronidazole, and it is also a quack like practice in the developing countries. So what's the mechanism of metronidazole? It actually make a free radicals in the body, and these free radical can cause destruction to the offending organisms, and it is also has this free radical has anti-protozoal activity. How its resistance is not very much common, and but its side effects are very much important. Metronidazole is a P450 inhibitor, and it can give disulfiram like effects when used with ethanol. And disulfiram like effects are hypertension, leads to a headache, and severe flushing and tachycardia. So its clinical importance is important. We use it in these type of infections. Whenever you encounter giardiasis, GIT infection, when you encounter entamoeba infection, trichomonas infection, Gardnerella vaginosis, then we have anaerobes such as particularly the bacterioids gram negative and Clostridium difficile, and with the B we have H. pylori infection.